We're going to look at the care and maintenance of an NSK high-speed handpiece, or any handpiece that has an NSK connection on the end. So when handling a handpiece, first of all, it's very important that it's not dropped on its head like so. It has a very thin wall on the head, and if this becomes dented, it's very, very hard to repair and sometimes can leave the handpiece beyond repair. Also, when sending it in for repair, if you are sending more than one handpiece in, make sure that they're individually wrapped so that they don't clatter and bang together. This can scratch them and also dent them. So first of all, we want to take a good quality lubricant spray and we want to give the can a good shake. This mixes the propellant gas and the oil within the can. If we didn't do that, we'd get the propellant gas out first, and that causes contamination issues. Now this device on top is called an easy oil. Very handy. You can oil up to 3 different high-speed connection types if you have 3 different types in your surgery. It also has a nozzle for a contra-angle handpiece and also for the chuck on high speed. So we're going to use the NSK connection here. As you can see, it is etched on the nozzle, so we can't get that mixed up. And we apply the handpiece there. Now I'm going to show you the oil coming out where the burr would normally enter, and also out of the back cap. Normally you will have this covered up with a paper towel to stop the spray mist, again causing contamination issues. So just to show you how it should be coming out. Now, as I say, that should be spraying into a clean paper towel, and the oil that comes out in that paper towel should be clean. If it's not, you need to repeat that process. Now you should be spraying there for 4 to 6 seconds to enable enough pressure to build up to turn the turbine inside. So we pop that off. We then want, so that should be done after every use of the handpiece, but once per week we want to apply some oil into where the burr enters. That's to clean out any dirt or debris within the chucking mechanism, which prevents lack of burr retention. So say this would be done once per week. You take a fine nozzle, or in the easy oil it's labelled rotor, so it can either be using this, or if you have an ordinary can of oil, it must be a little fine nozzle like that. This doesn't need much of a spray, it's just to get some oil in around there. So we want one little jet here. And then just wipe off any excess oil. Take an interdental brush and pass it back and forth. And that brush should be coming out clean. If there's any dirt or debris on that, again, repeat and apply more oil there. Clean the brush off, apply more oil, and that should be coming out clean. Now with the optics, take a cotton bud, apply a little isopropyl alcohol and give them a rub at the top. And you should also see the bottom of the optic rod at the bottom. Give that a clean. And you should see, when held up to the light, if you're looking from the bottom, you should see a nice full moon there. And that's how simple it is to maintain that handpiece. Now if you do have problems with water blockages, take a little bit of fine wire, and you'll notice there's 3, 4 or 5 holes around where the burr enters. Just pass the wire in through each of those and give it a little twist about, and that will hopefully dislodge any debris that you have in there. If that doesn't dislodge it, you will have to send it in for repair, because there are quite a few little O-rings in there that can become flattened and frayed, and that can block the ports. And if that is carried out, as I say, every time you use the handpiece, and then once per week do the chuck, you should find that your handpieces are going far longer before having to be sent in for repair.